Hello students, today we will discuss some basic concepts of the epidemiology. As you know, the definition of epidemiology was given by John M. Last and you must have mugged it up from the park. But we will try to understand the three terms which are given in the definition, which are very important. If you go for understanding the basics of epidemiology, the three terms in the definition itself are distribution, determinants and frequency. So first of all we must know what does this term distribution mean. So the distribution is meaning the distributed of the disease, where the disease is distributed. So the distribution can be in terms of time, place and person. So just look at some examples so that it becomes very clear to all of you. The distribution in the terms of time. So many diseases are distributed in terms of time. Maybe they have some seasonal variations, maybe there may be some yearly variations. So as you know, some disease occur only in the winters, like the respiratory infections, ARIs are the more common in the winters, while some diseases are also common in the summers and some in the rainy season. For example, all the vector-borne diseases like malaria are common in the rainy season. Why? Because generally the vectors of the malaria like Anopheles mosquito are more breeding in the rainy season. So there is a time distribution of disease. Many diseases follow time distribution. So we must know what are the time distribution of the many common diseases. Another comes to the place distribution. A very good example of place distribution, as all of you know, we must have read the history of medicine. There was the father of epidemiology, also called as the father of modern epidemiology, John Snow. So this person, John Snow, who is also known as the father of epidemiology and also called the father of modern epidemiology, also credited as the father of anesthesia. So this person, he was the first man who investigated the outbreak of cholera in England in 1854. Just imagine, generations before there was the discovery of the microbes, the generation of Louis Pasteur was still to come. And at that time, there was a miasma theory that the disease is caused by the miasma, which can spread by even surfaces or any other airborne, anything like that. The germs were not known, the microbes were not known. But John Snow used the simple techniques of epidemiology. He used the place distribution of the cholera deaths in the area. He made a spot map. The spot map was prepared and he put dots at all of the places where there were the So what did he do? He made a map and he put dots for the cholera deaths in the area, and he localized that there was a tap which was showing greater incidence of the cholera deaths in that area. So what did he do? He removed the handle of the tap and then he could save the lives of those people. And this was at that time when the cause of the cholera was not known. So he started the first scientific investigation of the epidemiology and he followed the technique called as the shoe leather epidemiology. So just by following shoe leather epidemiology, John Snow controlled the cholera deaths. So you can also go and see some videos about this incident. You will find it worth watching, and therefore he is credited as the father of the epidemiology and also father of the modern epidemiology, and the disease cholera is known as the father of public health. Most of the times you get confused when an MCQ comes. The father of public health is the cholera. It is not a person, it is a disease due to which there was public health awakening in the England, and later the public health was given due importance, and the developed countries now have controlled almost the infectious diseases. So in our country also you can see some place distribution of disease, like Kala-Azar is distributed mainly in the 4 states, like the and also you have the KFD, which is distributed mainly in the Karnataka. So still the place distribution is very common in the diseases. Then you have the person distribution of the disease, in which persons it is common. There may be variations in the age, there may be variations in the sex, male female variations. So some diseases are more common in the age group of the children, like the measles, 6 months to 3 years, main age group of the infection. Most of the childhood diseases are distributed in those years. And there can be old age diseases like cataract, generally greater than 50 years get the cataract. Then there are non-communicable diseases, hypertension, diabetes, generally greater than 30 have more incidence of that. Then there can be some sex distribution of the diseases, like some diseases are more common in the males, like the coronary heart disease, road traffic accidents. They are more common in the males. Some diseases are more common in the females, like gallstones, like you have the depression. Many diseases are more common in the females. But sometimes you are just tempted to ask that what are the sex restricted or sex limited diseases, like you have the cervical cancer or the prostate cancer. Cervical cancer can only be found in the females, while prostate cancer can only be found in the males. So they are the sex limited diseases or sex restricted diseases. So they are not sex distribution, they are the restricted or limited diseases. Okay. So then we consider next factor in the definition, that is the determinants. Determinants means what is the cause of the disease. So there can be various determinants of the disease. For example, for the infectious diseases, the cause is generally the causative pathogen. Along with that, we can have decreased immunity in the persons which is causing the disease. For non-communicable diseases, there can be a variety of causes, like the age, the risk factors, smoking, and alcohol use. They all can be the cause of the onset of that non-communicable disease, because you don't find any specific pathogen in those NCDs. Then we come to the frequency. Frequency of disease is very important. For example, just now we are just analyzing in the COVID-19 cases. We are all daily reading in the newspaper about the prevalence of the disease. India has this much prevalence, world has this much prevalence. So what is prevalence? Prevalence means the total number of the cases which have been found, that include the old cases as well as the new cases. So prevalence is very important factor when you want to consider some disease. And there is also another term called the incidence. So incidence, you can just remember, this is the new cases, only the new cases. So in a particular time, for example in 1 month, how many new cases were there? So we screen those new cases and that forms the incidence, while prevalence will be the new plus old cases. So both of the cases are included in the prevalence. So we should be very clear about these two terms. So generally, if you get some epidemiologist is generally concerned with the new cases and how to reduce the new cases. So prevalence and incidence are showing the burden of the disease in the population. So once again we revise in the end. The father of the modern epidemiology, was John Snow, and he worked on cholera, which is called as the father of public health. And in the epidemiology, we study about the distribution, determinants and frequency of the health related events, and we use them for the control and prevention of the diseases. So that's very important. So at least you can just go and revise the whole topic, and then we can continue in the next video.